Okay. So probably I'll switch off my video because I think the network is not very stable. So good morning, one and all. And the topic for today is webinars. What's in it for yours? This topic is not new for all of us because since the past year, we have been well acquainted with what webinars are actually. So, what's actually a webinar? It's an amalgamation of the two words, which is web and the seminar. And the things which we need is a stable internet connection, any device which is compatible, and different platforms where we can attend these webinars on. So, over the past year, there have been millions of webinars that are being hosted on different platforms. One is on All India Ophthalmological Society platform. Then there are iFocus online lectures available. There are also UC webinars which are being conducted every month. And there are all the lectures that are present on cyber side. They have now also come up with webinars. There are academic clinical webinars as well that have been present since over last 1.5 years. So it's almost like a cheese platter where we have a lot of things to choose from a big platter, and one and again we can have all the variety of webinars on different topics. Some topics are really innovative over the year, which we have seen, which were not there in the physical conferences before. So it comes down to one thing, that what exactly are the pros and the cons of these webinars, because there have been a lot of debates whether people prefer virtual webinars over physical webinars. So let's see what actually can be the pros. Definitely they have posed as motivation during those challenging times. We all agree, because in the beginning of the lockdowns last year, we were not sure what we are dealing with. And as for me as well, I was in the mid of my fellowship period, and I was not sure whether I'll be able to learn more on academic purposes. So we had a lot of virtual classes, which actually made me go back to the textbooks and read them very well. So one thing is that you can learn at your own pace, because sometimes in the physical conferences, sometimes you're rushing, you're traveling, or sometimes you're just too much lectures in different halls which you are not able to cope up. So in this we have an option of webinars that are present on YouTube or Facebook Live, that we can go back and see them at our own pace as well. But another thing is that they expose us to different faculties of different places in different universities and countries, and a lot of people which we are not, we have not been exposed before. So cons can be, yes, of course, we do not have any hands-on when we are seeing these webinars. There is no skill development in case of hands-on, but definitely video-assisted surgical training can be helpful. Sometimes there's too much information that is available, and we're not able to understand that whether this information will be grasped in and absorbed into our heads. So I just conducted a survey internally as well as on various public platforms to understand what people have what people hold the views about these webinars, and especially the category was of young ophthalmologists. So I asked them a question, that as compared to physical conferences, do you think that virtual platforms are better? And I saw an inclination of people towards the virtual webinars. Also, I had asked one question, whether it's contributing to learning. So again, I saw that there was a slight inclination towards the positive response, that yes, they felt that it is contributing to their learning in the period. I had also asked people that what aspects of these webinars they found useful or valuable. So a lot of people answered that questions and answers with the speakers, and the queries they have, if they are answered, are more helpful to them. And case presentations as well as video assisted skill transfers were found to be very much useful to the people. Then I had asked about the suggestions. So people said that definitely physical webinars are better, and webinars, they found that it could be more useful if we have option of viewing it later. and shorter and basics were more better for these people, I mean the young ophthalmologists. Some people felt that the advertising of the webinars was not very up to mark, so they were not able to understand and know whether the webinar is going on. Coming on to the conferences as well, we have seen so many conferences being conducted over the virtual platform over the past year, and we are part of one virtual conference as well this year. Uh, one positive point in global conferences is that because at the pedestal where young ophthalmologists are as residents or fellows, sometimes it's very difficult to get leaves, and this leads to loss of the training days, and also the stipends and the money they have in their pockets is slightly lesser, so there's a lot of travel expense, and as well as the exposure to international faculty is easier on these platforms. And there's a vast plethora of information that can be gained from the international faculty. Also, we have noted that there has been increased participation over these global conferences over the year because of all these advantages. Although coming on to the cons, definitely there are so many webinars which can cause digital toxicity, the eye strain, and there's a question of attention span that is definitely there, as was discussed in the first talk, that a lot of people are not able to cope up with the webinar content, as well as they are not able to get motivation for a longer period. So Nielsen Norman Group had conducted a survey where they found that a lot of audiences, they hold attention span of 10 seconds in the initial period. So if they do not find the content very interesting in the 10 seconds of their attention, so they do not feel like attending the whole webinars or the web pages. So as I said that there are so many webinars that is available. Is that possible to attend all of them? I don't think we can attend all of them. And sometimes they are so much confusing that there are some topics which are being conducted at so many platforms. You are attending all of them and you are not sure whether this webinar taught you the right thing or not. So it's definitely better to be selective when you are seeing all these webinars. Definitely, as we come to face-to-face meetings, we have better communication, and as was discussed in the first talk, that personal touches are better. And so many of us agree that these conferences are one of like alumni meet or friends catching up from different places, which is sometimes not possible during the working hours. Of course, we miss the good food that is available on all of these conferences. So the tips can be that we have to be very selective when we are attending the webinars. We should know what topics are we aiming on for attending these webinars. Speakers should also be helpful, as you know, so many speakers from international platforms are also available, and we need to learn a lot of things from these people as well. Also, it's very important that if you are learning or watching a webinar on YouTube or Facebook Live, so it's better to choose any day or a time with when we have a better attention span. Also, a useful thing is to put reminders on your phone. Sometimes we are busy in the work and we do not remember that this is the day and this is the time when a webinar was supposed to be there. So it is always good to put reminders for these webinars so that we do not miss them. So at the end, I would just say it's like a mixed feeling whether physical conferences were better or virtual are better. So one thing we definitely we can ponder upon is that virtual platforms do impart good learning to all of us. So for that, we need to be very selective, as well as the hybrid programs can be created for future where we have few virtual modules that can be useful, and then we can add on to short-term hands-on training in small batches. We are working on that as well at our hospital. So with that, I will end my talk, and definitely this is a debate which will never stop. So thank you for giving me the opportunity to speak today. Thank you so much.
Thank you, Gunjan ma'am. It was very exhaustive, very interesting talk. You gave us lots of insights into this webinar endemic, which is going on along with this pandemic. What I could tell from my experience is that one biggest limiting factor is the duration, the time slot with which these webinars being uploaded. It all often cross 1 hour, 1.5 hours. So from the uploader's perspective, they can divide the topics and they can upload it, like how we do for AIOC. One more tip is that they can put timestamps on the description box. So when we put these timestamps, it is easy for the resident to navigate to which path they want to choose and to watch and to learn from. From the resident's perspective, or from the audience perspective, one easy way to watch these long lectures or webinars is that watch in 2x speed or 1.5x speed. Kind of fastens the time spent or invested in learning. Also, it kind of keeps us attention for a long time. So thanks again, ma'am. Divakant sir, Digvijay Singh sir, any thoughts?
I think he's covered most of the prudent points. Something that we've found practically different in the webinar series has been that we've been able to do a lot of education programs across the country while still sitting in our cities. Like for example, they do the Glaucoma India Education Program as a part of the GSI, Glaucoma Society of India, where two speakers would have to first travel to a particular relatively tier 2 city or tier 1 city and give a talk. Now we could get the best of speakers sitting in their in the institutes and giving the same talks. So it was a benefit in that sense that it does make life easier. The logistics are also somewhat easier. You could be in two or three places within the same evening, which otherwise for some of the top speakers you couldn't. But that said, I do miss the fun of the physical meets and the physical conferences and the interaction that you can do there, because that to a major extent has a lot of we realize it now. So we realize the difference now that we've been doing these, that you do miss that one-on-one interactions or those group interactions that used to happen.
Yeah, I agree with Digvijay. A couple of things I think, Pranesh, you also mentioned. Having timestamps is good, especially when they retrospectively load it. Or actually, the first large-scale online conference was WOC last year, where they had a very interesting concept. Every talk had to be pre-recorded and uploaded. That way, every attendant or delegate had to go to their website, could pick the session they wanted to attend, could pick the talk they wanted to hear, and actually move till what part they wanted to hear, what section they wanted to hear. The trouble of having to sit live through the meeting, having to wait for the organizers to upload it later on, all of that was eliminated. Things like having concurrent live sessions was also something that was sorted, because everybody had uploaded their talk and kept it. It was like an online catalog which was open for 4 months. Anytime anyone could go pick and choose what they wanted. And I think that is high quality content curated with time limits. So that is another way that conferences should explore in which they are going.
I also tried one thing which is going to sound a little bit funny, but like we've all been hooked to all sorts of OTT platforms. I've tried to watch some of the longer webinars, like sort of web series, divided it mentally into certain blocks, and then gone on and seeing them, like listening to one talk or two talks in a day and then moving forward. The recorded ones available, of course. So because sometimes it's also that so much is going on in the other spheres of life that you do not get the time, but you are very much interested in the whole talk. But when one looks at the screen and sees, oh my god, this is like 2.5 hours long, so you can always divide it and see it at your own leisure slowly, instead of just expecting that you will be seeing it one full go. So that is one way that I tried, and I felt that was more useful than seeing all these things at a stretch. Excellent talk.